All right. So with me, I have Dr. Achina Stein, who is a doctor of osteopathic physician, board certified psychiatrist, and has been in practice since 1994. She's a certified practitioner of the Institute for Functional Medicine, a distinguished fellow of the American Psychiatric Association, and an Azarias energy healer. She was awarded the Exemplary Psychiatrist Award by NAMI, Rhode Island in 2008. Located in Rhode Island, she is the co-owner of Private Practice Functional Mind LLC. She is #1 Amazon International best-selling author of What If It's Not Depression? Your Guide to Finding Answers and Solutions. She has a YouTube channel and a podcast by the same name, has been a keynote speaker, and has been interviewed about her pioneering work as a functional medicine psychiatrist on many podcasts and summits. And as a companion to her book, she offers programs to find and reverse all the root causes of your depressive-like symptoms. And thank you so much for joining us, Dr. Achina.
No, thank you for having me, Dr. Eric. It's my pleasure.
Yeah, thank you. Thank you so much for doing this interview. And I'm sure you have a lot to share. And I'd like you to start off by giving your background. How did you start out becoming a psychiatrist and then eventually getting into the functional medicine world?
Well, we're going back almost 30 years. So, well,
I guess we could just focus more on how you made that transition to functional medicine and not just giving antidepressant medication.
That's an easier question to answer. Yeah, so I was a traditional psychiatrist, basically working in a community mental health center. I've worked in the prison system. I've worked on consultation liaison in hospitals. I liked moving around because I just loved having different perspectives. I've worked on the child unit, on the jury psychiatric unit. So I've basically treated all ages, but primarily with medications and psychotherapy. I'm trained in psychotherapy. And I was finding that I was hitting a wall basically in treating certain people where they just weren't getting better. And I'm one of those people that gets a really thorough history, spend a lot of time with my patients, more than the average psychiatrist, because I would really want to try to figure out what's going on, why are they getting better? And I spent a lot of time already talking about diet and exercise and sleep and habits and things like that. And so there was this feeling that in my gut, like in my heart, that I was missing something. And around that same time, coincidentally, and I don't believe in coincidences, but, at the same time, my son had a significant mental health crisis. This was back in 2010. He was 14 years old, and he had basically had a tiff with his brother that ended into like a meltdown, resulting in him standing on a fifth floor ledge of a building ready to jump. And, that's the kind of thing that kids tend to do. They feel like it's the end of the world in that age group, right? Anywhere from 10 to 14, 16, maybe something happens and it's the end of the world. And for him, he just lost it. And it wasn't something that we anticipated, or it was just kind of out of the blue. And he became severely depressed and very anxious, had insomnia. And I thought, oh, well, this is just it. This is my son who is now having an exacerbation of symptoms based on our family history. Both sides have depression, pretty significant depression on both sides, and suicidal ideation with attempts, actually suicide, completed attempts. So this was very concerning for us. And I really was blindsided by this. Here I am, a psychiatrist, right? And my son is having this serious situation, and I did not see it coming. And, it makes you think about your parenting skills and why didn't I see it coming? But the thing that made me think that something else was going on was the fact that he was not able to read at all. And this is a kid who was an avid reader and had really good memory skills. He would read it once, he knew it, hear songs once, he'd know all the words, that kind of memory. And he was just not able to read and retain. So I felt at that point, because of my skills at that point, were like, oh, there's something neurological going on. So I really honed in on, this is a brain-based problem, or neurological problem, and not psychiatric, so to speak. And I took him to many doctors and they weren't able to explain it. And I basically had to do a deep dive and research myself and find other practitioners to really help me. And serendipitously, I came across a functional medicine practitioner and had him see my son. I actually asked this practitioner if I could shadow him, because I was so intrigued with what he was doing, that I, shadowed him for a period of time. And that's when I decided, oh my gosh, you have to see my son. And so long story short, he got him well. And he made changes in his diet. He found that he was nutritionally deficient. He had celiac disease. He had a considerable amount of inflammation in his body as a result of having long-term, long-standing constipation since a baby, long-standing eczema since a baby, which we just assumed, oh, that's just him, and, you sort of take symptoms that are pretty serious and just think that's just normal, but it's not. So a lot of those symptoms, including the constipation and the eczema, completely resolved. And it took a little while for the depression and the anxiety to resolve. And mind you, he was on 4 medications at the beginning for psychiatric purposes. He was on an antidepressant, anti-anxiety medication, sleep medication, and a stimulant for concentration. And he was not my kid. So he was able to come off of all of those medications by the end of 2 years. And what we found was that the reason he couldn't read is because he had double vision. He had diplopia. So his eyes muscles became very inflamed, that he had double vision. And that's why he couldn't read. And that actually was the symptom that took the longest to resolve. So, once you see what you can see, once you learn those things and you just can't unsee it, and you just can't practice medicine the same. And so I basically became certified in functional medicine, and I left my job as a medical director at a community mental health center to practice functional medicine and learn functional medicine with the gentleman, Dr. Levitan at Visions Healthcare at the time, and started working for his organization because there was no other organization that did this kind of work locally. So, and I worked for them and learned functional medicine. And then once that practice closed, I opened my own practice with my partner, Sally Davidson. And here we are almost 5 years later. So that's all I do now. I have a handful of patients that I see for psychotherapy. And that's my mission, to tell people about this, because after my son, we got him well, I, did the functional medicine approach to my own health issues. I have Hashimoto's thyroiditis, which is very stable, has been stable for a number of years. And I had depression as a result of that, was on medication. And I have since been able to taper myself off of that medication as well. And I'm doing great.
Awesome. I'm glad you're doing better. And it sounds like your son is doing a lot better as well.
Oh, yeah, he's doing well. He's had his ups and downs. The thing about health is that you have to maintain it, right? And so guess what happens in college? You're stressed out, from all the studying. You're up late at night because everybody else is too, and you eat crappy food and you drink alcohol. And by the time he graduated from college, he had to start all over again. So yeah, and so, but that's true for anybody. If you start, picking up those old habits again, then, you're just not, you're going to go back to those same symptoms. And that's what happened. So, but the beauty of functional medicine is that once you know what works, all you have to do is just get back on the wagon again. So, and he knew exactly what he needed to do. And he did. Within 6 months, he was back on track.
Yeah, and you mentioned a few things you mentioned. One, you mentioned inflammation, and then you mentioned symptoms related to the gut, including constipation. And it's only really been recent that, and I can't even say all psychiatrists, you would know better than myself, but I guess still many psychiatrists just think about depression related to the brain, same thing with anxiety, and no relation when it comes to inflammation, no relation when it comes to the gut. And it probably comes down to the training that you also had in medical school. Would that be correct?
Well, I had, as a DO, we are required to do a year internship in all other disciplines. So I delivered babies and I saw kids in pediatrics rotation. I did surgery. So, we're required to do an internship, and then that's followed with 3 years of psychiatric residency. So, yeah, I mean, that I'm very comfortable talking about medicines and, medical issues, much more than I think the MD counterparts. Yeah, but like I said, I've always talked about medical issues with my patients, and particularly in the community mental health center. Many patients do not like to go to doctors, and they have to go to their psychiatrist to get their medications. But they try not. They're either paranoid or they don't trust them, and so I would really talk about their medical issues and connect the dots for them. And this is before I even did functional medicine. So I just had that mindset, and talking about diabetes or weight or hypertension. And there was a point where I would be monitoring even some of these things for them until it's like, you know what, now I really need you to see your primary care. I just can't manage these things, but yeah, so it was such a logical transition for me to become a functional medicine doctor, because that was a piece that was missing for me in caring for my patients. It made so much sense. I remember seeing a patient once in the community mental health center. She said, "Is it normal to see pills in your stool, like undissolved?" And I thought, I had to ask myself, is it normal? And I was like, no, I don't know, And it's like, no, it's not normal. It's not normal to see pills in your stool. It's not whole pills. That means you're not digesting it all. It's not normal to see food, large particles of food in your stool. You're not digesting. That's a major root cause of mental health issues. You're not digesting and assimilating all your nutrients and fats and proteins, which are so necessary for the brain and the rest of your body. But with the brain being so sensitive, you absolutely need to be able to absorb and digest, absorb and assimilate, right, your food. Mm-hmm. So yeah, so as I became a functional medicine doctor, there were patients in my mind of like, oh, that's why that person didn't get better. Oh, that's why, like, it just, all these people would pop into my mind about, oh, what I could have done differently, because I'm always thinking about them. What could I have done differently? What could it, still to this day, there's puzzles that I have not solved. And so that's how I approach people. I like to solve problems and solve issues and try to figure out what's going on, and really keep digging and finding what's going on with that patient. So,
yeah. So since a healthy gut microbiome is important really for overall health, including, mental health, everything's connected. So that sounds like it's a big part of what you do. You want to find out what's caused. If we could talk about leaky gut, I guess, but a lot of people are familiar with that. But you want to try to find out the cause of the leaky gut, or, the dysbiosis, the imbalance in the gut flora, and try to address that. And when you do that, I'm guessing you see dramatic changes in your patient's depressive-like symptoms.
Absolutely. So depression is just a symptom of inflammation, when it comes to, well, like, that's not that's not 100% true. I mean, it's the root of the root of the root, really. You know, it's figuring out where the inflammation is coming from. And so we look at biological causes, psychological causes, social causes, and physiological or functional causes. And it's really connecting the dots. So the depression is just one manifestation of that complex of symptoms. And so if someone has an underlying autoimmune process going on, then the root cause for the depression really is that autoimmune process, or at least one layer. So you want to find all the layers. So it could be because your job is stressful. It could be also that you have a toxic boss, and it could be that you have 3 kids, then one of them has special needs. It could be that you had trauma from your early childhood. And so all of those things cause your cortisol levels to go up, which then can cause leaky gut, right? So, it always comes down to, in my mind, to 4 things: foods, infections, chronic infections, toxins, and stress. And all of those really affect your hormones, particularly cortisol, which is your stress hormones. And so if you're looking with that foundation of issues at those 5 things, then you will definitely find all the root causes. But it's looking in all of those realms. And what most psychiatrists do is that they look at the biological and possibly the psychological and possibly the social, but they don't really connect the dots in terms of nutritional deficiencies. I had a patient today who had a vitamin D level of 18, and her primary care provider put her on vitamin D, but only 1,000 or 2,000. And she sees a psychiatrist. And she has seasonal affective disorder. Psychiatrists never, they don't think about these nutritional deficiencies, never asked what blood work had been done, at least hers. No, she says hers never did. There are some psychiatrists who have more training around this, looking at B12 and folate, which are, highly connected to not only, depression, but other issues. It is looking at all this nutrition. And so nutritional psychiatry, believe it or not, is a brand new field, and integrative psychiatry has been around for a decade, but it's not really as accepted. But it's coming around. People are learning more and more about these connections that are in the field, especially the newer graduates are learning about inflammation, brain inflammation, and BDNF alpha, and all of these things that are now in the literature. But you might learn these things, but it doesn't really come into practice, honestly, for another 10 years. It takes a good 10 years, sometimes 15 years, to actually see it in everyday practice where it's common knowledge. But at least there it is moving in that direction. And I can say I was, asked to be the plenary speaker for a American Psychiatric Association conference out of Oklahoma. And I was asked to talk about my methods as a, pioneer in the field doing this, or they considered me a pioneer in the field doing this when I've been doing it for, 10 years now. And it's good that they asked me, right? They could have ignored me and it's like, oh, she does that thing. And so people do want to learn. And I'm absolutely seeing shifts in a positive direction around this. Absolutely. So it'll take its time, but it'll happen.
Yeah. Oh, yeah. I'm sure it's moving in the right direction. Like you said, more and more younger psychiatrists coming out of school, they're getting different types of training that they did, when you were in school.
Mm-hmm.
So yeah, I definitely think that it'll be more than just dispensing medication in the future, which unfortunately that still happens probably too frequently. What you mentioned earlier, so you experienced with Hashimoto's, and you said the Hashimoto's kind of is what, like you had the Hashimoto's before the depression. Mm-hmm. And so people understand, because Graves' disease also, I work with a lot of Graves patients and personally had Graves, and just like Hashimoto's, it's autoimmune. And of course, there's many other autoimmune conditions, but with Graves, uh, anxiety seems to be more closely associated, but people with Graves can also experience depression as well, and that also could be, and not could be, but is tied into the inflammatory process, as well as the leaky gut that's associated with autoimmunity. So really, essentially, anyone with any autoimmune condition, would you say they're at increased risk of developing depression because of the inflammation, because of the gut issues?
Sure, and some more than others. I mean, lupus and multiple sclerosis and myasthenia gravis have a higher incidence of depression, as well as Hashimoto's and Graves, but much more than the other types of autoimmune diseases. Definitely celiac. So you'll see certainly low levels of depression and anxiety across the board, but the more severe types of depression you'll see in lupus in particular. You can have a very significant, it can actually show up first as an initial symptom of lupus. So about 50% of patients with hypothyroidism have been given a diagnosis of major depressive disorder. Hypothyroidism is a major root cause. And it happens to be the one illness that is, searched for as a possible explanation for a major depressive disorder. And if blood work is not done to look for that, then you're really, the average doctor is not practicing the standard of care. I mean, that's been done for at least as long as I've known, and even before my day, that getting a TSH, and we'll talk about, there's certainly limitations. I'm sure your audience knows that there's limitations just from listening to you with getting the TSH, but there was an effort to, determine whether or not a person had the depression from hypothyroidism. But there is there's certainly not enough, that's not enough data nowadays, to know if you have a clinical hypothyroidism that's playing a part, or just not looking at, the entire thyroid panel. It's so important to do a full thyroid panel. And there's still many doctors this day that don't believe in getting a full thyroid panel. I have to convince doctors to do the full thyroid panel. And so, I think it's just a matter of not being educated about these things. And eventually things like that will catch up.
So you mentioned subclinical hypothyroidism, and for those who don't understand, that would be elevated TSH and then thyroid hormone levels that are within at least the lab reference range. It might be lower than optimal. So if someone has overt hypothyroidism where the thyroid hormone levels are below the lab reference range, so that could definitely increase the risk of having symptoms of depression. But it sounds like if I heard correctly, if someone has subclinical hypothyroidism, that could also be a factor when it comes to depression, even if the thyroid hormone levels are within the lab range.
I think so. Yeah, there's that in between gray area that I think it can make a difference. So it depends on what the numbers are, right? And what else is going on too. So I've seen when people have had high levels of adrenal
Cortisol,
cortisol, yeah, cortisol levels. Their adrenaline's up all the time. There are Energizer bunnies, and just under a great deal of stress, the thyroid will down regulate it to balance, as a normal response, to balance the adrenals. And so it's looking at the whole picture. Like, why is that happening? Why is the thyroid sort of going into either putting on the brake? And sometimes the thyroid goes into hibernation, like just shuts down, the metabolism on some level, so that it goes into safe mode, right? Like our computers go into safe mode, our bodies go into safe mode. How? By downregulating the thyroid.
Yeah, that is true.
Yeah. So not everyone needs necessarily to be treated. I wouldn't necessarily say that they have a disease or a disorder, but it's a dysfunction. But it's a dysfunction, or actually, in a way, it could be an appropriate function or response to something else happening in the body, right? Yeah.
Yeah, some of the things we mentioned, again, it's they have Hashimoto's, that inflammatory process, the gut microbiome,
Mhm.
and I'm sure that there are other things as well. And you mentioned testing. So you mentioned testing for the thyroid, but is there any other types of testing? You mentioned nutrient deficiencies. Do you look at, do you do like neurotransmitter testing? Like what type of testing do you do? And it might vary depending on the person. But so I guess if someone comes in and you're suspecting depression, what are some basics that most people get? And then if there are other tests that you might give some people but not others?
Sure. I mean, I get a stool test through, I don't know if you want to know companies, but
Sure, sure you can.
GI map. I get the GI
Sure.
map stool test. If I suspect SIBO, I'll get a breath test through Aero Diagnostics, the organic acid test from Great Plains Lab. I will also get a whole battery of blood work, which CBC, CMP, comprehensive metabolic panel, a DHEA, homocysteine, lipid panel for sure. So like a cholesterol below 160 is very concerning about depression. Vitamin D, vitamin A, copper, zinc, magnesium, selenium. Those are critical minerals that are needed under a stressful environment. And imbalances in those areas can cause depression and anxiety. What else do I get? So like
CRP, did you say that
CRP,
inflammatory markers like?
HSCRP, sed rate, DHEA, which is a marker for stress, the stress hormones like cortisol. And this is blood work. So an omega-3/6 panel to see what the balance is of omega-3s and 6s. And I'm sure I'm missing something else.
Yeah, and you don't have to give everything. I was just trying to get an idea, but that's pretty comprehensive, even if you've left a few out.
Yeah. It's so, I don't necessarily just treat the depression and narrow my focus as depression resolution. I treat really the whole body. I've always treated, so it's the other symptoms that will help me to understand where the depression is coming from. So if somebody has metabolic syndrome and insulin, resistance, right, then depression can be caused from that. If they have low cholesterol, and they have anorexia, then the depression can be coming from that. So it's really looking at patterns in the symptoms and patterns in the blood work that will help to find the root causes of the depression. So I go after the root causes and the depression resolves because I see the depression as really being part of that pattern. It's just part of the manifestation of what's happening in the whole body. The times where I really hone in terms of specific symptoms is really after doing a full gut restoration, removing what's causing inflammation, replacing what's missing, re-inoculating the gut microbiome, repairing the gut lining. And then what happens is that the fog clears, right? And so then there's pieces of that depression that then we can really focus on. And it might be childhood trauma, or it might be that their life is so stressful that they're not taking time to rest. And, of course, we've already addressed sleep and exercise or movement and the diet by that point, but it's then really honing on and fine tuning the approach to specific things that are happening that keep causing, sort of mediating the inflammation or triggering the inflammation. So like I said, like the toxic boss or the marital problems or not knowing how to manage the kids at home or not managing time, not giving time to yourself, or having chronic feelings of guilt, shame, fear, or anger. It's really then honing on those things. And you asked about neurotransmitter testing, and I used to do it quite often in earlier when I started doing functional medicine. I really don't find them to be useful. I just didn't. It's a dynamic process, and you can really figure out, where there needs to be support by just getting a really good clinical history, and and I think you asked, there might have been another question you asked, but now I'm forgetting because you asked several questions.
That's okay. With the yeah, I agree with the neurotransmitter testing. I don't do that, but I know I don't use the organic acids testing on everybody, but on some of my patients, and that of course looks at some of the markers, some of the metabolites related to dopamine and
Mhm.
serotonin and epinephrine, norepinephrine. So, but of course that gives so much more information, like yeast and
Right.
if someone has a candida overgrowth, put some mold markers and
Right.
indicators of detoxification. Again, you're familiar with it, of course, but some of the listeners might not be familiar with
Yeah.
that.
The
So,
beauty of that test is that first page, those the microbial organic acid test part, the first page is really, especially the Clostridia, because you can't really pick that up without testing. The thing about depression is that many of the symptoms are of like a major depression, a clinical depression, are things that you would see in a classic sick syndrome, so low energy, sleep problems, thinking problems, appetite problems, right, concentration problems. If somebody had the flu and was really, really sick, you would feel that way. It just happens to be that people with major depression feel that way every single day, all day. And so, what we aren't trained, or hadn't been trained, and many psychiatrists aren't trained, is to look at that as this is a whole body illness that just happens to be affecting the brain, and that
mhm.
it's the brain hardware and software, right? And so why don't we look at this as a whole body problem where, if you had a problem with your computer, hardware, it's going to cause it to glitch, right? So our brains are just glitching on some level. I find that when people don't feel well, their perceptions of what's happening around them changes, including their perceptions of any trauma that you may have had in the past. When you're not feeling well, you're not processing things well, and things come up that in the past probably wouldn't have come up if you felt well. So just the not feeling well is shouldn't necessarily be considered, oh, now you have major depressive disorder, and completely isolate it from the body, right? So your head is connected to the body and it's all connected. So to treat it as a separate entity, I think, is a huge disservice to people.
Yeah, I definitely agree with that.
Mhm.
And I mean, with really any type of condition from a functional medicine standpoint, you want to take a whole body approach. So,
Mhm.
and again, unfortunately, still many well, pretty much all conventional medical doctors take the opposite approach. But again,
Yeah.
as we discussed, more and more practitioners are learning about functional medicine and keeping an open minds. And when it comes to diet, is that one of the starting points too? I imagine just like pretty much all functional medicine practitioners, it's changing diet and I guess where do you start when it comes to diet? Is it just eat whole healthy foods, or do you require all your patients to go gluten free, gluten and dairy free?
Well, ideally, I would want them to be gluten, dairy, and sugar free in the beginning. And but I always start where the patient's at, and if they've never been gluten and dairy free, and don't have the resources or the support around doing that, you basically have to start in baby steps. So if they are terrified of this deficit of things that they've been eating, I'll start with, let's add some fruits and vegetables, because generally people who are on the standard American diet will be devoid of fruits and vegetables. So starting by adding things, I think it's a lot easier to add things first. Well, that might be not the case for some people who have a really hard time with vegetables, but starting with adding things, it's a negotiation, like where, with the patient, where are you willing to start? This is where we need to be. This is my experience in being gluten, dairy free. It's really worth doing an elimination diet. So, I've actually found that the Whole30 is something that people can wrap their heads around, as an eliminate. It's a modern elimination diet, basically. And that might be a good place to start for some people. But, essentially, my goal is to get them to a Mediterranean diet, and then maybe a paleo, and then potentially, if they still need some, some more push or oomph in the clearing of brain fog, let's say, then I might push to keto. So if they're still having energy issues or brain fog, then like the ketogenic diet. But I don't believe in that people should stay on a diet long term, a specific diet. Diets should evolve seasonally. They should evolve based on what other issues are happening. So I use the diet as a way to shift the metabolism, shift the microbiome in order to a healing state. And then, you can start adding things back. And I have had people be able to add things back in that otherwise they thought they would never be able to. So if you can heal the gut, a lot of times you can reintroduce these foods, but there's a way to do a proper way to do these things.
Yeah, definitely agree with that.
Mm-hmm.
And you mentioned low cholesterol. I'm glad you brought that up, just because it's very common with hyperthyroidism for people to have low cholesterol. And so that also, you mentioned that could be a factor with depression. And you mentioned 160. You don't like to see the levels below 160, correct?
Correct. Yeah. Below 160 definitely can be causing depression. Cholesterol is a building block for your brain cells, right? It's insulation. It's a building block of insulation around your brain cells. Your brain is 80% fat. And what's cholesterol? It's fat. So you need enough cholesterol in order to make hormones too, as well. So there are actually studies that show that cholesterol levels below 100 or even 80 can cause chronic suicidal ideations, daily chronic suicidal ideations. There's multiple studies that show that. And unfortunately, when we have people in the hospital, it's not even a test that's drawn. Especially in young kids, it should be drawn. In kids and teenagers, young adults, it's not a test. A lipid panel is rarely drawn in the younger age group. I think it should be part of every battery of tests when it comes to depression and especially suicidality.
When it comes to low cholesterol, so if someone has hyperthyroidism, they have to address, of course, the elevated thyroid hormone levels, and it could take time for that to increase. But when it's not related to hyperthyroidism, do you have any strategies for low cholesterol? I know sometimes it could be genetic, but do you mostly try to increase it through diet?
Yeah, other than food, like eating eggs, it's also helping the liver. Cholesterol is made by the liver. So it could be that, the liver is not making, doesn't have sometimes the liver gets congested and it doesn't have the machinery running in terms of actually making cholesterol. But there is actually a supplement that's made by a company that's called Sonic. You can get it from New Beginnings. There's only one company that I know of that actually makes cholesterol pills, and you can actually take some supplements to boost your cholesterol level. I've had a couple patients with autism that have taken that. I see low cholesterol in quite a few kids with autism as well.
Oh, interesting. So yeah, I think I heard. I didn't know if at least I don't remember was through New Beginnings. I'm familiar with New Beginnings, but yeah, I knew there was a supplement out there that was mentioned with that helps with cholesterol. So that's good to know. And so one thing I wanted to also quickly ask you is, as far as SSRIs, just a lot of people are on the medication, including a lot of children. Are there what are potential long-term consequences of being on the medication? I guess one is just not addressing the cause of the problem and just masking them with the medications, but are there any other side effects when it comes to the meds?
Sure. I mean, first of all, medications do poop out, and at some point they really don't work any longer. And so what it can do is actually cause some neurological problems in terms of this imbalance of serotonin and dopamine. So you end up becoming uh, low in dopamine and resulting in almost these neurological issues related that's almost like a Parkinson's type symptoms. That's not really called Parkinson's, but there are people who end up having these neurological symptoms that are related to low dopamine. That's a long-term risk of being on SSRIs. But as a result of taking them for a long time, it really changes the balance in your brain on an almost permanent level, that when you try to come off of these medications, many people do have a discontinuation or a withdrawal syndrome that is really, really hard for many people. It's very painful in many ways. People get zapping, ear ringing, tinnitus, dizziness, lightheadedness, nausea, upset stomach, headaches. There even neurological symptoms in terms of finger sensations. There's a whole list of symptoms that people can have. Dyskinesias, even, which is abnormal movements. Akathisia, which is like a restlessness, ants in the pants kind of feelings. These are not comfortable feelings. And unfortunately, people end up having to go back to the dose that they were taking. And although it's not necessarily doing anything for their depression anymore, they just have to take it because they can't get off of it. Mm-hmm. And there are many doctors who don't know how, and we're certainly not trained to be able to taper a patient off of these medications safely. When we were trained, and this is when I was, working as a psychiatrist, our understanding was like, once you're on a medication, you have to stay on it because now you have this illness that will never go away. And that is far from the truth. If you address the root causes, and you can absolutely bring the body back into balance. And I have been quite successful in getting many people back into balance and getting them off of medications as well. It takes a while, and it's not for everybody. There's some people where I've been able to taper if they've been on 4 or 5 medications, because that's the problem. You have medications that poops out, then another medicine started, and another medicine started, and it's just like this whole polypharmacy that at some point the side effect combinations of these can cause side effects. Like the number one cause of death in this country is polypharmacy, being on all of these medications and no one really managing the drug-to-drug interactions that are occurring. And, the solution is just to keep increasing the dose, and increasing the dose until person is just so frustrated that they just stop the medications without even discussing it with the doctor, because the doctor is not going to support that, unfortunately. And that seems to be the trend. Of course, you're going to find the occasional doctor that will work with you and try to, reduce and discontinue these medications. But for the most part, there's no training around what to do. So it's very, very important to find someone who knows how to do that, but also know that there are definitely risks in taking these medications. But there's also benefits. I'm not suggesting that you shouldn't take the medicines. You really have to look at the benefits versus the risks at the time. Certainly, these medications can be life-saving, but you want to have that conversation and have really good informed consent around the decision, and also to have a plan to come off of it when it's time. And so I kind of liken it to rehab. If you ever had a car accident, God forbid, it never happens, but if you had multiple broken bones and you need the jaws of life to get you out of the car. You're going to want to be helicoptered to the hospital and be in surgery and fix whatever needs to be fixed and have your bones put in casts, etc. But you know that you're going to come out of those casts, right? The plan is coming out of those casts once you heal. There's no plan like that in psychiatry. There really isn't. So there's going to be crises. Absolutely. Things are going to happen where, like, my son had an acute mental health crisis and he was on, put on meds. Thank God there were meds. Thank God. But, there was no plan for him to come off of it. And fortunately for him, I became a functional medicine doctor and was able to do that with him. So there's definitely a way. There's definitely hope that can happen. But I'm not anti-medication. I'm pro informed consent. That there's certainly a place for them.
All right. Well, thank you so much for sharing that. And yeah, it's probably a good idea for someone who's taking a medication, and if their doctor isn't willing to help them wean off, then they probably should see someone like you, or someone else with, I don't know, what do you say, they need to have like a functional medicine background, or is it just the fact that many conventional doctors just refuse to help people wean off? And like you said, once they're on it, it seems like all they do is over time just increase the dose. And so I don't know. It should, obviously, someone like you would definitely help them, but are there conventional medical doctors that do help people that have been on it for a long time?
But it's not like there's this organization that advertises them, what I mean? But there are definitely websites that you can go to. I don't have them in my head right now, where there are organizations that do help people come off of SSRIs. There's one major one out of England, actually, that is a huge proponent of trying to get people off, helping people get off of SSRI medications. But there are other possibilities. I mean, if you needed a supplement, there are things that you can use, like L-theanine and GABA. There's taurine and tyrosine. There's 5-HTP. There's SAMe. There's all of these herbal formulations, or natural formulations, I should say. They're not necessarily herbal, but there are some combinations as well. So a combination of vitamins and some of these things that I mentioned that work really well, and can really help to stabilize you while you're searching for the root causes. It doesn't have to be these heavy duty medications. I think certainly in a severe crisis, you should try the medications. But if it's a mild to moderate, sometimes there are risks in medications. There are medications in certain populations, like kids and adolescents, can cause suicidal ideations, right? So there's certain, or a manic episode, there's risks in taking them. So you want to make sure that the benefits far outweigh the risks when you're choosing to take a medication. So there are a combination of supplements that you can take instead of medications. And I don't recommend that you take them while on medications, because there are drug-to-drug interactions. You want to avoid combining the two. That's not safe at all, because there's things like serotonin syndrome that you can actually put you in a crisis. So you absolutely, if you're listening to this conversation, absolutely need to work with someone who knows what they're doing in this arena.
And so when someone comes in with depressive-like symptoms, just to kind of summarize, we know that you want to address the cause of the problem, but treat the whole body. But what are some of the first steps you would do just if someone's listening to this and they're wondering, okay, or they're convinced they need to see you or the different psychiatrists that practice functional medicine, what should they expect?
Well, first, I think doing a screening for making sure that you're not in an acute crisis. So I would make sure that you're safe and that you were able to function on some level, because, functional medicine does take work and it is time. You have to have the ability, you have to be well enough, unfortunately, to do the work of changing your diet, do the work of doing exercise, and all of these habits that need to be in place. So if you are, having an acute depressive episode, and you're in crisis, you shouldn't go to a functional medicine doctor to help you. You really should see someone who can, sort of stabilize you, possibly with medications, maybe even hospitalization if that's necessary. Sometimes people have called me and it's like, no, you really need to go to the hospital. You're not safe and you're not functioning. If you're hearing voices, if you're having chronic suicidal ideations, if you're paranoid, you should seek help right away and get stabilized first. Once you're stable, then come see me, because I'm not going to be able to help you until you're able to do the work that's required. And your brain needs to think on some level. That doesn't mean to say that it might not be hard, but you have to be able to do a certain amount of work, and it's over time. So you're not going to get results immediately, but you could get results within 30 to 60 days. I see people feeling so much better just by changing their diet in 30 to 60 days. And sometimes that's faster than some people who started an SSRI and didn't change their diet at all. So I would say that making sure that you're safe, making sure you're not in a crisis, and you do have to be willing to do the work and investing the time. So creating that space for yourself, putting yourself first, putting your oxygen mask on first, saying you deserve it and that you are worth it is really, really important mindset changes. And having a destination, like where do you want to be in the very, you need a destination. It's not just, I want to feel better. You want to, it's not about suppressing symptoms. It's about being well. And so you have to have an idea of where you're going in the process too. So I have people do this exercise to really have in their mind's eye, okay, this is where I want to be. And these are the things I want to be doing when I'm well. Right? Yeah.
Makes sense. Yeah. Thank you so much for sharing. And so where can people find out more about you? Obviously, there's the book, which definitely recommend getting. What If It's Not Depression? And I assume they could find that Amazon, maybe your website.
Correct. Yeah. You can find What If It's Not Depression, Your Guide to Finding Answers and Solutions is on Amazon, and you can get it at my website. It's www.fxnmind.com. I have another website, which is www.achinasteindio.com. You can see my name there. It's just my name, achinasteindio.com. And I'm also on Instagram and Facebook. On Instagram, it's Dr. Stein, and Facebook is What If It's Not Depression with Dr. Achina Stein. And I have a YouTube channel too. And my videos, you were also one of my guests. So we can watch your video, but also other experts in root causes of depression, and as well as tools to resolve symptoms of depression and anxiety. Yeah, thank you.
All right. Well, thank you. I'll make sure, of course, to include those links in the show notes. And again, thank you so much, Dr. Achina. It was great chatting with you. And yeah, we might have to have you on again in the future, just because there's so much to talk about and so many other questions I have.
Oh, great. Yeah, I would love that. And thank you so much for having me. It was my pleasure.